Tonight, with the number of bariatric procedures being performed in this country rising to an estimated 170,000 this year, it's likely the number of patients who need a second operation will go up as well. It's called revision bariatric surgery. The reasons can vary from surgery complications to weight gain or too much weight loss. Whatever the reason, the surgery is a complicated one. MedWatch talks with one Valley surgeon who is known worldwide for perfecting this procedure and a patient who traveled with him to show doctors in other countries how it's done.
Goldie Marty loves living in the country. She exercises by walking her dogs in her vineyard. After losing about 90 pounds with gastric bypass surgery 10 years ago, she felt great.
Look it, Mama's got it.
Then an injury put her in a full leg brace for 7 months. Unable to exercise or even cook for herself, she regained about 60 pounds.
Not a failure of the first procedure at all. The first procedure was perfect and my results were good. I didn't want to start facing health problems due to weight. And as I said, I couldn't get it back off. I just could see where I was going.
Goldie looks back at pictures and says at the time she felt trapped in a box.
The diets and exercise worked for me unless I had gained too much. And then I was just stuck. I didn't gain any more, but I couldn't get it off.
Then her doctor told her about laparoscopic revision bariatric surgery.
I knew that there was a revision. I had no idea that the same rules didn't have to apply. I thought that you had to be 100 pounds overweight.
No pain, doing well, then let's discharge her.
Her surgeon, Dr. Kelvin Higa, is a clinical professor of surgery at UCSF Fresno and president of the American Society for Metabolic and Bariatric Surgery.
It's not just about making the stomach smaller, it's about individualizing the treatment for each patient.
Dr. Higa is known worldwide for this procedure. Shown here helping a patient at the Fresno Heart and Surgical Hospital in Fresno, he actually did Goldie's surgery in Portugal to share his knowledge with about 100 other surgeons from Japan, South America, Europe, and the U.S.
Into our world, these are the superstars. These are the Michael Jordans of surgery, all coming together in one forum to discuss this topic.
Dr. Higa says he hopes by everyone sharing their knowledge, they can help prevent complications for future patients. However, he feels there's one thing that matters most.
It doesn't matter if your surgeon is known nationally, internationally. All that matters is that you have a good relationship and trust with that doctor.
He's a wonderful doctor that I trust him with my life, and I certainly felt safe in his hands.
Most doctors and patients prefer a laparoscopic gastric bypass surgery, whether it's a revision or a first-time operation, over an open procedure because there's usually less pain following surgery and a quicker recovery for the patient. Here's how it works. Making tiny incisions, the surgeon uses small instruments and a tiny camera to guide them as they perform the surgery. A small stomach pouch is then created. The surgeon will construct a bypass for food. The bypass allows food to skip parts of the small intestine. By skipping a large part of the small intestine, the body cannot absorb as many calories or nutrients. Due to scar tissue and other issues, a revision is much tougher.
The complication rates are much higher in revision. The danger is higher. And so the screening process has to be much more intense. The risk-benefit ratio is not quite as dramatic. So therefore, when you go after revision, you have to be satisfied in your mind as a surgeon that you're really going to do some good, that you're really going to help out.
For Goldie, that was true. The weight loss wasn't as dramatic as after her first surgery, yet by following the same rules as she did before, like drinking plenty of water, exercising, and watching what she ate, she has lost 20 pounds in the first month.
I feel energetic and healthy all the time. And, of course, I trust my doctor with my life. I told him that I would let him perform surgery in a bus terminal with a spoon, if necessary.
You know, it's never as easy to remodel a house and to build a new one. And it's really true in this. And our statistics show this, too, because for any given complication, it's at least double or triple on a revision surgery than it is on a normal operation we do. And so we don't take revision surgery lightly by any means.
Dr. Higa believes in treating his patients for life. Goldie wouldn't have it any other way.
I had the surgery on Monday. I was out of the hospital Tuesday afternoon, and I had my water bottle and I was walking. It's still going the right direction. It's going down and not up.
As was the case for Goldie, weight loss surgery was the last resort. However, Dr. Higa believes it saves lives. Patients can see big improvements in diabetes, high blood pressure, cholesterol, and other serious health issues. For more on revision bariatric surgery, visit our website. It's MedWatchToday.com.